I'm Dr. James Robert Wilson, an internist with 60 years of experience, formerly the head of internal medicine at a top university hospital. At 90, I'm still healthy, sharp, and full of energy. My secret isn't pricey health checkup packages, but smart choices based on experience from treating thousands of patients. In this post, I'll reveal the concerning truth about unnecessary tests hospitals often push, alongside the truly critical tests to protect your health. In just 7 minutes of reading, you can save thousands of dollars, avoid needless worry, and live healthier in your golden years. Are your annual tests silently causing harm? Are comprehensive health checkup packages truly necessary, or just a way for hospitals to maximize profits? Is your health anxiety being exploited to push unnecessary tests and prescriptions? The sad truth of modern medicine is that overdiagnosis and unnecessary tests can turn a healthy person into a patient. Think I'm exaggerating? Let me share a real story. Mrs. Linda Marie Thompson, 67, was a patient of mine who regularly got full-body checkups. During one, an MRI brain scan showed a minor white matter change, common in older adults due to aging. But after hearing the doctor's advice, Linda became obsessed with fears of stroke or dementia. She started feeling anxious, lost sleep, and even slipped into depression. Her health declined rapidly, and she was prescribed unneeded antidepressants. Ultimately, the fear of the test results harmed her health more than any condition. As for me, at 90, I only do minimal tests focused on what's truly necessary. Before we begin, I would appreciate it if you like this video. You can help me continue to spread the old age lesson. If you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. If you like this video, please comment number 1. If you don't like it, comment number 0 to let me know, so I can make a better video for you. Now let's get started, completely free. Share this post with loved ones to help them enjoy a healthy old age. Let's dive in. Part 1. 3 critical tests you can't skip. Before discussing unneeded tests, I want to highlight 3 vital tests I always recommend for patients, especially after 50. These tests have saved thousands of lives, including my patients and myself. 1. Colonoscopy. Why is it critical? A colonoscopy is a silent hero in detecting colon cancer, polyp, or inflammatory conditions like ulcerative colitis. The colon is deep in the body, so symptoms often aren't clear until the disease is advanced. According to the American Cancer Society's 2024 data, colorectal cancer is among the top 5 cancers for men and women in the U.S., with over 150,000 new cases yearly. Luckily, if caught early, the cure rate for colorectal cancer exceeds 90%. Precancerous colon polyps often take 5 to 10 years to become cancerous, and regular colonoscopies can detect and remove them, effectively preventing cancer. A real story. Mr. Thomas Edward Clark, 71, was my patient. He had no symptoms but agreed to a colonoscopy on my advice. It found a 1.5 centimeters polyp with early-stage cancerous cells. The polyp was removed during the procedure, and he needed no further treatment. Thomas shared, "I thought I was fine and didn't need tests. Thank goodness I listened to my doctor. I dodged a bullet." He now gets colonoscopies every 3 years and stays healthy. I started colonoscopies at 60. At 75, I found and removed a small polyp. Even doctors like me aren't exempt. Over 60 years of practice, I've seen patients who get regular colonoscopies live much healthier in old age than those who delay. Recommendation: start at 50, or 45 if there's a family history of colorectal cancer. Frequency: every 10 years if normal, more often if polyps are found. After 80, discuss with your doctor based on health and expected lifespan. I stopped at 90 as the benefits no longer outweighed the risks. Benefits: reduces colorectal cancer death rates by 60 to 70%, per the American Cancer Society. Complication rates are low, under 0.5%. Note, the U.S. has screening programs offering fecal occult blood tests, FOBT, every 1 to 2 years for those over 50. If positive, a colonoscopy is often covered or low cost, about $25. If you are still watching this video and finding these lessons useful, please comment number 1 below to let me know that you are still watching this video with me. Thank you for your valuable time. 2. Upper endoscopy. Why is it critical? An upper endoscopy examines the esophagus, stomach, and duodenum, detecting conditions like ulcers, H. pylori infection, or stomach cancer. The U.S. has a high stomach cancer rate, with about 26,000 new cases yearly, per 2024 global cancer data, largely due to high H. pylori infection rates, over 50% of the population, and precancerous conditions like atrophic gastritis or intestinal metaplasia. Stomach cancer in early stages often has no symptoms, but if caught early, the 5-year survival rate exceeds 95%, compared to 20 to 30% in late stages. A real story. Mrs. Emily Susan Davis, 67, joined a national cancer screening program. Despite no symptoms, her endoscopy found early-stage stomach cancer. After a simple endoscopic surgery, she's lived healthily for over 10 years. Emily shared, "I was scared of endoscopy pain, but I'm so glad I did it. If I delayed, I might not be here. I started upper endoscopies at 40. At 70, I was diagnosed with atrophic gastritis and intestinal metaplasia, so I increased endoscopy frequency to yearly. Modern sedated endoscopies are comfortable, not like the old days. Recommendation: start at 40 or 35 if there's a family history of stomach cancer. Frequency: every 2 years, yearly if precancerous lesions are found. After 80, discuss with your doctor. I still do them at 90 due to high stomach cancer risk in some populations. Benefits: reduces stomach cancer death rates by about 47%, per U.S. studies. Sedated endoscopy complication rates are very low, under 0.01%. Cost: about $50 to $250 through national screening programs. 3. Comprehensive blood panel, CBC, lipid profile, blood sugar, liver, and kidney function. Why is it critical? A comprehensive blood panel is a simple, low-cost way to assess overall health. Metrics like complete blood count, CBC, detect anemia or infections. Lipid profiles check cholesterol and triglycerides for heart risk, blood sugar screens for diabetes, and liver/kidney function tests evaluate vital organs. Per the CDC, diabetes and heart disease are leading causes of death, accounting for over 30% of U.S. deaths yearly. Early detection through blood tests allows timely intervention, reducing complication risks. A real story. Mr. William Henry Adams, 62, found high cholesterol and prediabetes through routine blood tests. After adjusting his diet, exercising, and taking medication, he avoided heart attack and type 2 diabetes risks. William said, "I never thought a simple blood test could save me from serious illness. I've done annual blood tests since 50. At 80, I found high cholesterol, managed it with diet and exercise, no drugs needed. This keeps my heart healthy at 90. Recommendation: start at 40 or earlier if at risk for heart disease or diabetes. Frequency: yearly or as doctor directed. Benefits: early detection of chronic conditions like diabetes, 7 to 10% prevalence in those over 50, and heart disease, cutting complication risks by 20 to 30% with early treatment. Cost: low, about $50 to $100 at public hospitals. Part 2. 4 tests to avoid after 60. Now, let's talk about tests hospitals often promote, but which may cause more harm than good, especially for healthy older adults. 1. Routine echocardiogram. Why is it unnecessary? An echocardiogram is a non-invasive test to assess heart structure and function. But for older adults without symptoms like chest pain, shortness of breath, or high heart disease risk, smoking, hypertension, diabetes, routine echocardiograms offer little benefit. Issues: high cost, $75 to $150, not always covered by insurance. Unnecessary anxiety: finding minor issues like mild valve sclerosis, common in aging, leads to worry and more tests, and low effectiveness. Per the American Heart Association, echocardiograms in asymptomatic people find clinically significant issues in under 5% of cases, with treatment changes in under 1%. A real story. Mr. Michael David Lee, 67, got an echocardiogram in a checkup package. It showed mild aortic valve sclerosis, causing him to worry, lose sleep, and stop exercising for fear of heart issues. After much counseling, he learned it was a natural age-related change needing no treatment. He said, "I wish I hadn't done that test to avoid the stress." At 80, I skipped echocardiograms since I had no symptoms and a normal ECG. Instead, I manage blood pressure, exercise, and eat healthily. Recommendation: only do echocardiograms with symptoms, chest pain, shortness of breath, unusual fatigue, abnormal ECG, or high heart risk. 2. Routine brain MRI. Why is it unnecessary? Brain MRIs are useful for diagnosing strokes, brain bleeds, or vascular malformations. But for older adults without neurological symptoms, severe headaches, dizziness, paralysis, they're not recommended. Issues: high cost, $250 to $500, often not covered. Unnecessary anxiety, finding minor issues like silent brain infarcts, common in 20% of those over 65, rarely progress to stroke, and discomfort, lying in an MRI machine for 30 to 60 minutes can be stressful. A real story. Mrs. Sarah Jane Miller, 76, got a brain MRI in a premium checkup. It found a small brain aneurysm, causing panic that she had a ticking time bomb. After much counseling, the aneurysm was deemed low risk, needing only monitoring. But she stopped exercising, canceled travel, and became depressed. At 85, I had a brain MRI for brief dizziness but found nothing. The experience was uncomfortable, so I won't repeat it unless serious symptoms arise. Recommendation: only do brain MRIs with clear neurological symptoms. Instead, manage blood pressure and live healthily to prevent strokes more effectively. If you are still watching this video and finding these lessons useful, please comment number 2 below to let me know that you are still watching this video with me. Thank you for your valuable time. 3. Routine PET scan. Why is it unnecessary? PET scans use radioactive tracers to assess cell metabolism, useful for diagnosing cancer or neurodegenerative diseases. But for healthy older adults, routine PET scans aren't recommended. Issues: very high cost, $500 to $2,500, not covered. Radiation risk: radiation is 10 to 100 times higher than a chest X-ray. And false positives: only 1 to 2% of findings are cancerous. Most are benign, leading to anxiety and more tests. A real story. Mr. Richard Allen Carter, 73, got a PET scan in a premium checkup. It showed a mild thyroid metabolism increase, leading to an unnecessary biopsy. It was benign, but he lived in anxiety for a month. I've never done a PET scan, as I have no cancer symptoms or unexplained fevers. When PET scans were introduced at my hospital, I saw high false positive rates in older adults, causing undue worry. Recommendation: only do PET scans for confirmed cancer, unexplained fevers, or weight loss. 4. Routine tumor marker tests, CEA, CA-125, PSA. Why are they unnecessary? Tumor marker tests like CEA, colorectal cancer, CA-125, ovarian cancer, or PSA, prostate cancer, are often promoted in checkup packages. But for those without symptoms or high risk, they can do more harm than good. Issues: high false positive rates. Per the American Cancer Society, over 30% of PSA positives in those over 60 are due to benign prostate enlargement, not cancer. Anxiety and more tests. Abnormal results lead to unneeded biopsies or invasive tests. And cost, $100 to $250 per marker, not always covered. A real story. Mr. Stephen Paul Harris, 68, got a routine PSA test. A slight PSA rise led to a prostate biopsy, which was benign but caused pain and anxiety. He said, "I regret doing that test. I don't do routine tumor marker tests due to low specificity. Instead, I focus on colonoscopies and endoscopies for early cancer detection." Recommendation: only do tumor marker tests with symptoms, weight loss, unusual pain, or high risk, family history, long-term smoking. Part 3. Healthy lifestyle, the key to a vibrant old age. Over 60 years of practice and personal experience, I've learned that health in old age comes not just from tests but from a healthy lifestyle. Here are tips I follow and recommend to patients. Exercise regularly. Walk 30 minutes daily, 5 days a week, cutting heart disease and stroke risk by 20 to 30%. I still walk 3 miles daily at 90. Eat healthily. Focus on vegetables, fruits, fish, limit red meat and processed foods. I follow a Mediterranean diet to manage cholesterol and blood pressure. Sleep well. 7 to 8 hours nightly reduces dementia and heart disease risk. I sleep from 10 p.m. to 6 a.m. Manage stress. Meditation, yoga, or social activities boost mental health. I joined a book club to stay sharp. Quit smoking and limit alcohol. Smoking doubles to quadruples cancer and heart disease risk. I quit smoking at 40 and stopped drinking then. A real story. Mrs. Patricia and Lewis, 72, had high blood pressure and cholesterol. After my advice to walk, eat more vegetables, and reduce stress, she avoided medication and has lived healthily for over 15 years. Conclusion and call to action. Over 60 years of practice, I've learned that health checkups must be personalized. Colonoscopy, upper endoscopy, and comprehensive blood panels are 3 essential tests to catch cancer and chronic diseases early, with high cure rates. Conversely, routine echocardiograms, brain MRIs, PET scans, and tumor marker tests aren't needed for healthy older adults, as they cause anxiety, high costs, and risks. Act today. Discuss with your doctor. Choose tests suited to your age, gender, and family history. Prioritize a healthy lifestyle. Exercise, eat well, stay positive. Join national cancer screening programs for low-cost, effective options. Have you had a helpful or unnecessary test? Share your story in the comments to help others. If this post was helpful, like and follow the Life Insights channel and turn on notifications for valuable health tips. Share this with loved ones. A small action could save their lives. Here's to a healthy, happy old age with smart choices. Thank you.